lecture in the dental anatomy module is about teeth identification, both differences between set traits, all primary and permanent teeth, and some differences in the class traits, type traits, and arch traits. Okay, we will have little introduction about the physiology of the permanent dentition. You will have this part of the physiology thoroughly in the end of the second semester. You will have the development of the permanent dentition in the next module, in the second module, which is the oral embryology, oral and dental embryology, and the physiology you will have it in the second semester. Starting, that's just a summary. This is called the set traits. Set traits, it means deciduous or permanent dentition. So deciduous, it's the starting or the first primary teeth to erupt in the oral cavity and to develop also. Main traits. Now, generally the primary teeth, they resemble their counterparts, we've said, in the morphology. They resemble permanent teeth morphology. But one major exception we have is not the second molar, but the first deciduous mandibular molars, which they don't look like anything, we've said. This is only a very quick revision. The maxillary first molar and the deciduous maxillary first molar, it resembles a little our permanent maxillary first molar. Okay. However, we have it resembles the first maxillary molar. It resembles the premolar, the first premolar. Okay, but it have 3 roots. Anyway, the deciduous second molars, we've said, always they look like resemble the permanent first molars in both arches, maxillary and mandibular arches. Okay, and this is called a set trait. Normally, and a general rule, they are smaller. The deciduous teeth are smaller because we have smaller sized jaws in the child, and we require less functionality, less smaller teeth, smaller occlusal tables, and here you go. In general, we have 20 rather than 32 teeth in the permanent dentition. We have missing of premolars, we've said, and we have the presence of third molars. So, try to mute, please, your because I haven't muted your mic. Okay, so furthermore, we have the important structural differences between primary and permanent teeth are in the external morphology and structure, mineral density. That's why here the primary, they look whiter because they are hypomineralized. And we have some differences regarding the treatment, the dental treatment or the specialty. Okay, so otherwise than the cutting, how to cut, how to fill, how to extract the teeth, you already said about it in the clinical considerations in the primary teeth lecture. Okay, just very rapidly, we've said about the crown, the numbers and the classes of teeth, the dental formula, you've said about it. The incisors, ideally the incisors in primary dentition, they don't have mamelons, but they have them in the permanent incisors. Also what's different is the width. The width of incisor is very wide mesiodistally than labiolingually, okay, for the primary tooth. This is not the case. The permanent incisors are longer cervico-incisally than wider mesiodistally, okay? And this is one difference in the crown height and length ratio. For the canines, now the lateral the same. For the canines, what's different is that primary canines tend to be more conical in shape, and they have sharper cusp tips that is more pointed, okay? The permanent canines not as constricted, not as conical. Now, if we move to the molars, normally we've said we have 2 molars, not 3, and we
دكتورة حضرتك ميوت لو مش منتبهة.
Okay. We were saying about the molars, okay? That in permanent molars we have first, second, third. The size of the molars gradually decreases, okay? But this is inverse in the deciduous dentition because we have second molar is larger than first molar, okay? Other than that, other differences would be like the first molar upper have 3 roots and 3 cusps, and they resemble the premolars, okay? The second molar is, it looks like more like 4 cusps plus the accessory cusp, which is the carabelli. And lowers, we have only 2 cusps. Only 2 roots. We have 4 cusps for first and 5 cusps for the second molar. This is the second deciduous molar. We will not go further for more the constricted cervix, and this is a set trait for the primary dentition. Okay. Here you go. Yes, as we compare mesiodistal dimensions for the crown, for example, we have primary teeth more mesiodistal, more mesiodistally wider than the permanent anterior teeth. This is, we have the cervical ridge that is prominent in primary, and the height of contour is more prominent labially, okay? But in the counterparts, the permanent teeth, they are flat. They don't appear as prominent as in primary. Last thing or third thing to look at is the occlusal table. You will learn more about it in the lecture of occlusion, the occlusal table. But don't forget, okay, we have the less occlusal table for the primary teeth because we have less need for grinding, okay? Roots, what is different? They look, in the primary dentition, they look like they are taller than in compared to the crown. But ideally, what is very important is roots in the permanent and broader root trunk to be able to withstand the forces. This you will have, you already had a little how the deciduous dentition erupts, and you will have it fully in the second semester, whole module about the eruption and the movement of the the shedding, the movement and the shifting of the primary teeth here in yellow, and the permanent dentition also. Okay, this is 10 minutes about primary and permanent.